Good afternoon. My name is Lorraine Klashinsky, and I'm the Executive Director for the Health Innovation Cluster for the Department of Health and Wellness. Today, I have the honor of being your Master of Ceremonies. We are pleased to welcome you all to Murphy's Cornwall Pharmacies for this exciting announcement. I would like to acknowledge the presence of our distinguished guests who are gathered here this afternoon. The Honorable Premier, Dennis King, the Minister of Health and Wellness, Ernie Hudson, Aaron McKenzie, Executive Director of PEI Pharmacists Association, and Ray Murphy of Murphy's Pharmacies. Without further ado, I would like to invite the Honorable Premier, Dennis King, to come and say a few words on behalf of Prince Edward Island.
Thank you very much, Lorraine, and thank you to all who have gathered. It's a very exciting day, one that's been a long time in the works. Good afternoon, bonjour, Quay. Again, I say thank you to everyone for being here with me today. I want to recognize Minister Hudson, the Minister of Health and Wellness, who's been, I would have to say, the most resilient, strongest leader I've met in a long time. You've been through a lot of go, Ernie, but we're starting to make the progress that we knew we would begin to make. So thanks for sticking in through it. So it's been a godsend. I want to say hi to Ray Murphy and Ryan, Carolyn, and thank you for welcoming us here. Aaron McKenzie. I think Michelle might show up here. Michelle Wine also, and Minister of Finance and the MLA for this district, Mark McLean. So thanks for being here, Mark. And to all of the staff who are here behind the scenes who have helped make today happen. In the face of the rapidly changing landscape of healthcare delivery and with labor challenges in many of the key healthcare sectors, our government has been focused on what we can do to increase access to care for Islanders and to build a stronger, more resilient healthcare system from tip to tip in this province. I've said it time and again, and I'll say it here again today, that when Islanders really need access, when they're able to access healthcare services in this province, it's top quality. Seldom when I'm out talking to Islanders from tip to tip do I hear about issues of the quality of service that Islanders receive. The issues tend to be around the difficulty Islanders have in getting timely access to healthcare. This problem isn't unique to Prince Edward Island. It isn't unique to even Canada. It's something that's taking place around the world. There's a shortage of healthcare professionals in every province and territory in this country, and as I say, around the world. We have made, and I'm proud that we have made record investments to combat some of these challenges. We've invested strategically in the UPEI Medical School. We've invested to expand seats at the School of Nursing. We've added additional cohorts for RCWs and have provided free tuition for those entering study. Those strategic investments are critical, but they will take a little bit of time to solidify. But they are important investments, and I'm glad we were able to make them. But we also know that we live in the real world, and the real world is that Islanders need timely access to health care now. In the past, I think the focus has been on things that we don't have. And much of the efforts have been put forward to try to get more in a competitive world where more has proven very hard to get. It's obvious to anyone working within the system or anyone trying to access the system that we can't keep doing the same. It isn't working. That was also obvious to the 30 or 35 healthcare stakeholders that Minister Hudson and I met with a number of weeks ago in the cabinet room, those individuals representing unions and regulators and various professional associations. We talked at length about the challenges, but also about the potential we have for us to look at trying to find solutions within. And an overarching question around that table was, can we complement the high-quality professionals we have in our healthcare system, maybe take some of the pressure off those who have been working incredibly hard, and make it easier for Islanders to gain access to services perhaps a little closer to home by better utilizing the professionals we have in our midst right now. Aaron was at that meeting, and Michelle Wine was at that meeting. They spoke about the untapped and underutilized professionals that we have in our communities, large and small, rural and urban, right across the province. And those are our pharmacists. They talked about how we could take pressure off other areas of the system and how our local community pharmacists could be the first step in your healthcare journey for non-urgent, routine healthcare issues. They spoke about how pharmacists are willing to help, they just needed to be asked to help, and they needed support from government. And so, Pharmacy Plus PEI program was born. This program that we are launching is launching in 48 community pharmacists in 16 communities across the province, and it's starting today. The Pharmacy Plus program, thank you. The Pharmacy Plus PEI program will provide, free of charge to Islanders, the ability for pharmacists to assess and prescribe to start for 32 common ailments, for things like cough, sore throat, seasonal allergies, heartburn, minor joint pain, and many, many others. In addition, community pharmacists will also be able to provide renewal for eligible prescriptions. Pharmacists will complete a review of the entire patient profile and will renew all prescriptions as they deem appropriate during your visit. We anticipate that this program alone will alleviate up to 27,000 visits in the first year to other areas of the healthcare system, such as walk-in clinics, doctors' offices, and emergency departments, leaving those services for patients with more complex healthcare needs. Now, I want to be honest with all of you and anyone who's watching here today. We don't believe that this program is the be-all or the end-all. We know, having learned from watching for many years, there are no silver bullets for healthcare solutions. But we think this is the first step in broadening access to care for all Islanders. This is not meant to be a replacement of the current primary care options that you may visit, but we do feel, as I say, that this is a positive complement to increasing access to quality levels of health care for Islanders. It will provide 48 new access points for Islanders to get access to health care services in Prince Edward Island. It will provide timely access close to your home. And it will be, as I say, the first step in your health care journey for many. It will provide the single mother who has a child with a rash access to health care in Tyne Valley, instead of having to take the morning off work to drive to the walk-in clinic in Wellington on a Wednesday morning. It will provide the senior who lives in Wheatley River who needs their prescription renewed access to health care in Hunter River instead of having to wait hours at the emergency department at the Queen Elizabeth Hospital. It will provide the university student who lives in Surrey who has concerns with their seasonal allergies the ability to book an appointment instead of having to go wait in a walk-in clinic or at the ER. This program might not fit for every ailment or illness, we know that, but it does provide care for some of the most common and routine concerns that Islanders may experience. I've often spoken about of having to change the way we look at healthcare in our province. We have to work with the roster of healthcare professionals we have so that Islanders can have access to care now. And the Pharmacy Plus PEI program does this. It changes the way we access care using trained professionals like pharmacists that are available within our communities, large and small, urban and rural. It's the first step of many things we have to change and alter in our system, but it's an exciting one. Yes, we know and we will continue to invest in healthcare professionals and in the system itself. We must continue to recruit healthcare professionals to the province, and we have to continue to be creative and innovative in our approach to training new professionals, and we have to put a greater focus on retaining those professionals in our province. We know we must build greater flexibility within our system so that healthcare professionals can enjoy a healthy and safe workplace and enjoy a healthy work-life balance that we all need and want. We're doing all that, and we'll continue to do that, and there are more steps to come. But we're confident that today's announcement will make a positive difference to Islanders. I want to thank Aaron. I want to thank Ryan and Ray. I want to thank everyone in the profession who has worked hard to bring this day forward. I want to thank Lorraine, our MC. She's been a tremendously dedicated and she's persevered through some difficult challenges to get this over the finish line today, so I'm grateful for that. I want to thank all of you for stepping up to the plate, for putting Islanders first, and thank you for helping Islanders get access to health care a little bit closer to home. We have a little momentum going. Let's keep it rolling. So thank you. Merci, Walala.
Thank you, Premier King. Now I'd like to call upon Minister Hudson.
Well, thank you very much, Lorraine, and it certainly is a pleasure to be here with you this afternoon. Want to thank the Murphy family, who has been very helpful, very willing to work with us in different capacities, but certainly in hosting events similar to what we're having here today. Certainly recognize Aaron McKenzie. It's great to be here with Aaron. My cabinet colleague, Mark McLean, thank you for coming out. Premier, thank you so much for your maybe overly kind comments, but it has been it's been an interesting going on 2 years in this portfolio. But one of the things that we're seeing here today is the partnership that we have developed. And I want to thank you, Premier, for your partnership, for working together so tirelessly with myself on the healthcare files, and also the staff both in the Premier's office and in my office for the tireless work that you do. It certainly is appreciated. If it wasn't for the work that you do, the work that Lorraine has done, we wouldn't be at events like we are having here today. So I certainly want to give a shout out to everybody that has worked so hard to make this day happen. And I'm not sure if it's by chance or completely good timing, but I do understand that today is Pharmacy Technician Day. So what an appropriate day to have this announcement. But with that, folks, again, thank you for joining us here today. Offering high-quality, timely access to healthcare to Islanders right across PEI continues to be our #1 priority. Today's announcement is tremendous for the future of our collaborative healthcare system, a healthcare system that has been, needs to be, and will continue to be there for all Islanders. The Pharmacy Plus PEI program is part of the work underway by the government to rebuild, to modernize, to provide increased access to healthcare services for Islanders right from tip to tip. Our journey as a province in healthcare is unique. As part of our previously announced primary care roadmap, patient medical homes deliver team-based care through a model that has been endorsed by the College of Family Physicians of Canada and that will continue to provide access for Islanders tip to tip. This plan sees healthcare professionals working together to their full scope of practice in a collaborative, team-based environment. We know that not all common ailments require a visit to see a doctor. And we also know our community pharmacists cover the island from, as I've said, tip to tip, right from Tignish right to Surrey and all the areas, all the communities in between. They have been champions for Islanders over the last 2.5 years of COVID-19, quickly pivoting their operations to stay open, taking a lead role on COVID vaccinations, flu shots, and shingle vaccinations. And for all of that, my heartfelt thank you goes out to you. And today's announcement is the most logical next step, supporting pharmacists to do more in our communities. As we continue to add to the healthcare system through programs such as the Pharmacy Plus PEI, using a collaborative approach ensures that we are not adding burden on our healthcare providers. A collaborative approach can reduce the need for emergency room visits, walk-in clinics, and provide support for quality improvement in our healthcare system. I want to thank the entire team that worked so tirelessly to make today a reality. The Pharmacist Association, the PEI College of Pharmacy, and certainly our government officials. And again, to you, Lorraine, thank you so much for all the work that you have done on this file as well. As a team, we will continue to work together to add programs, to add initiatives, and to improve our health care for all Islanders. Thank you.
Perfect. Thank you, Minister Hudson. I would now like to invite Erin McKenzie from the PEI Pharmacist Association to say a few words.
Thank you, Lorraine. And it is really exciting to be here today. The messages that we've been sharing this morning have been messages that we've been talking about for a long time. And we do know that with the pressures on the healthcare system, it's going to take everyone to step up and really practice to their full scope of practice. And we're really excited that this government was willing to hear some of the innovative ideas and follow up on them and get us to the point we are today. So we really look forward to that. And I think really one of the other things that I have to mention that really got us to be able to talk about this lovely Pharmacy Plus program is the pharmacists themselves. They've shown time and time again how important they are to the pharmacy community, but also to the patients that they serve from one end of the province to the other. So I think they've shown what they can do. They've shown how important they are in healthcare, and we're really glad to see this opportunity come forward today. Thank you.
Thank you, Erin. I would now like to invite Ray Murphy of Murphy's Pharmacies to say a few words.
Thanks, Lorraine. Good afternoon, everyone. Premier King, Minister Hudson, Minister McLean, ladies and gentlemen. First of all, thanks for being here. This is a big event, and this is an exciting day, believe me. The introduction of Pharmacy Plus PEI. There's been a lot of work been put into this, as has been alluded to, and we're looking forward to the days ahead going forward. This has been talked about for years, this whole initiative, and we are happy to see that this government has stepped up to get this particular project over the finish line and to provide a fully funded service that pharmacies can now deliver to Islanders from tip to tip. This, as we can all appreciate, is a much needed progressive step forward to advance the health care of the residents of this great province. This initiative will, make no doubt about it, will provide better health care for all Islanders. And other provinces offer this type of service with great success. I look forward to us not just providing it with great success, but over the long term, this province will and has the ability to lead in many areas, not just in healthcare, but in other topics of importance to the province. We're small, but we know we're mighty, but there's opportunities here, given our size, to lead the way in many different fields. So this is just a start, in my opinion. And we all know that to meet Islanders' needs, we have to have better health care access in every community. And this is what's been indicated in the comments earlier. It's a well-known topic that has to be addressed, and this involves utilizing all healthcare providers appropriate and in the right fashion, working together to coordinate and improve access to care. It's all about teamwork. Pharmacy Plus PEI is a step in the right direction in terms of utilizing pharmacists' skills, their skill set, their training, and their education. We all know they're well educated and they have lots to offer. The goal remains and will be continuous to have better health care access in every community. And number of communities that this is being focused on is pretty telling to the commitment that's being put forward by this government to make sure that nobody is ignored, nobody is left out. We're here to provide the best in all parts of this province. So pharmacies and pharmacists are here to help make this particular project happen. In that light, to all parties involved, Premier and his team from the government side, Erin and her team from the pharmacy side, I just want to extend a sincere thank you. This is a tremendously important initiative, and for you folks to come together, to sit around the table, and to make this initiative work, it's pretty telling that collaborative practices are important, but it takes cooperation to make it work, and you have done that. So thank you very much.
Thank you, Ray. At this point, we'll ask our distinguished guests to come for a photo. Afterwards, there will be an opportunity for media questions. Thank you, everyone, for coming.